Jim Longworth, and welcome to a special edition of Triad Today as we focus the next half hour on health care and look back at some conversations we had with some of the good folks that provide health care for us. Let's watch. This may be the most important visual aid I've held up in my 50 years of doing television because we're going to try to make everybody more aware of these signs and symptoms of stroke, and an expert is with us to help us do it. Right next to me, Dr. Jason Edsall's Chief Medical Officer and Emergency Department Physician at Northern Regional Hospital. Thanks for coming down.
Thank you for having me, sir.
Let's go through this, okay?
Yes, sir.
All right, now we can see that it spells out be fast. We're going to tell you why you need to be fast about recognizing these signs, but let's go through each letter. B, there's an indicated on the little cartoon there of balance. What does that mean?
Well, certainly if someone starts stumbling around kind of all of a sudden, that's what we mean by balance when it comes to stroke.
Watch out for that. There's an E and a cartoon figure of eyes. What does that have to do with the symptom there?
Sure. When we talk about eyesight, what we're talking about is typically a cut in their eyesight. Maybe they can't see anything on the left side. Again, all of a sudden.
So it's blurred for no reason.
That's correct.
Okay.
Yes, sir.
F, and we see a face indicated there on the drawing. Something looks like it's, drooping or?
That's correct, yes. One side of the face may be drooping down and they can't make a smile, sort of like the Mona Lisa.
Okay. Now, A is indicates arm, but I guess this could also mean a leg as well, but A for arm. What are we talking about, some kind of weakness or what?
That's correct. You would see a droop on one side of the arm. They couldn't hold it up as good as they hold up the one on the other side.
All right. S for speech.
A slurred speech pattern. Maybe they repeat things over and over again. Maybe they slur their words together.
Right. Now, the final one is T for time, and the indicator on the little drawing there is time to call 911. My question to you is, why do we need to be so quick? Why is time so important?
Well, our interventions for stroke are really time-based. The best interventions we have, things like clotbuster drugs, have to be given within 3 to 4.5 hours of the onset of symptoms. There are new and exciting new strategies to treat strokes that go out as far as 24 hours, but the quicker, the better. Millions of nerve cells die every moment that the brain is without blood.
So time is of the essence. And that's why I think this, and I want to thank you and Ashley and the whole team for providing me with this, because I didn't want to just flash up something electronically for a second. I just thought it was good to keep reminding folks about these symptoms and what to do for it. Let me ask you, does stroke affect everybody the same? I mean, is it more women than men, black than white, young than old?
Well, it can affect anyone of any age. However, we do see a prevalence in older folks, especially women.
Anything I can do, I want to put you on the spot, we didn't rehearse this, but is there anything that folks can do to maybe prevent getting a stroke later on?
Absolutely. Quit smoking. Control your diabetes, control your high blood pressure, ask your doctor about treatments for high lipids in your blood, like high cholesterol.
Yeah.
Those things can help modify your risk for stroke much later in life.
Make regular visits to the doctor, get the blood test. And boy, I appreciate you taking time to do this, and I know you are seriously a lifesaver, and I appreciate all the work you do for folks, and thanks for coming down and doing this.
Thanks for giving us the opportunity, sir.
All right, Doc. Here up on screen, choosenorthern.org is the website, choosenorthern.org. We'll be right back. Back now on Triad Today. I'm so glad we can spend a few minutes with this guest. She's been with us before, and we're always glad we can steal a few minutes of her time because she does so much for so many people. And we're welcoming Christy Sharpa, who is Senior Director of Practice Management at Mountain Valley Hospice and Palliative Care. Welcome, Christy.
Thank you.
Thanks for coming back.
Appreciate it.
Just for folks that maybe didn't see you on the program some months before and aren't familiar, maybe they just moved into the area, how would you describe what the Hospice Advanced Cardiac Care program is all about?
Well, we're taking our hospice population of folks who have advanced heart failure or problems with their heart and really focusing in on how we can really expertly manage their symptoms, give them a little extra special attention, and really our primary goal is to help them be as well as possible, as comfortable as possible, and to be able to stay home and out of the hospital.
Now, why is the focus on heart failure patients? Why such a focus on that now?
Because heart failure is the #1 leading cause of death across America, and so many of those patients miss out on their hospice benefit. So we're really working hard to bring attention to that and help these people get the care that they need and live as long and well as they can.
I mean, since you mentioned how widespread this problem is, who among that group is qualified to get into your program?
So certainly patients who are appropriate for hospice care who have been optimally managed by their cardiologist with the appropriate medications, but they're still finding themselves in and out of the ER and having a lot of symptom burden, trouble breathing, chest pain, fluid buildup, things like that, where they're really losing a lot of life quality. And we can help manage that and navigate that a bit.
Now, you mentioned a cardiologist or their own doctor, so I'm going to just ask you this straight out. If someone is under your care, for hospice and palliative care, can they still continue to work with their own cardiologist?
They can, yes. There's times when folks find that that doesn't become necessary anymore. There's a partnership there. But there's other times when folks might say, you know, I'm close with my cardiologist. I want him to remain part of my care. And in those cases, it's absolutely appropriate, and we welcome that.
Right. And of course, you get families involved on these decisions. You know, of course, on the hospice side, we talk about families making a decision to receive hospice care. And this is a little bit different because you're trying to, as you said, improve quality of life early on, right?
Absolutely, yes. There's research that proves that folks will live longer and better if they start their hospice care earlier.
Even with a chronic illness, that's true.
Absolutely, yep.
Let me, we didn't rehearse this. I'll put you on the spot. What's gratifying to you about working with patients and families?
Well, in this particular specialty, people are afraid of serious illness and end of life all across the world and medical care. And for folks that specialize in this, you know, we're moving in when everyone else is moving out. And we believe there's always something more that can be done. And so to see people genuinely live longer and better and meet those goals in life, and if it is their final chapter, to close it in a meaningful way with their family, there's nothing else more gratifying.
Well, I just think what you're doing is great. I want to, before time gets away from me, I want to put this up on screen. www.mtn, it stands for Mountain, of course, valleyhospice.org, MTN, mountainvalleyhospice.org, or you can call 888, which is a toll-free number, 789-2922. That's 888-789-2922 to get more information for you. If you're someone who has a loved one with a chronic condition or qualifies on this, you can get in touch with them through that number. But check out the website and read about that too. And of course, you have the new Winston-Salem office that's helping with people if they want to meet there. And I just thank you for all you're doing for so many people.
Thank you so much.
All right, you're going to come back sometime?
Yes.
All right, we'll be right back. Is in sort of getting back to shape and doing more activities, but doing it safely and doing it without getting injured. And if you do get injured, what do you do? We have a gentleman that's going to help us with all those topics. Next to me, Dr. Steve Lucy, orthopedic surgeon, among other things, wears many hats. Wake Forest Baptist Health. Welcome to the program.
Thank you. Thanks for having me.
First of all, let's remind folks what sports medicine entails, because we're going to mention that throughout the segment.
Sure. Sports medicine, really generally speaking, is just caring for athletes, but it's athletes of all ages. The difference would be if I have just a general orthopedic patient that's not an athlete at all, you might devise one treatment plan, but if it's an athlete, then you have to factor in the return to sport. There's usually more aggressive nature to those patients, and so really the sports medicine aspect comes into really taking that treatment plan and shifting it with a goal in mind of return to sport, return before the season starts, factoring those seasons in.
But you don't have to be a professional or seasoned athlete to get help in sports med, though, right?
Absolutely not. No, we pride ourselves in taking care of athletes from young children to people in their 80s that are still active.
Yeah. How about me? I was active 60 years ago.
You're still an athlete.
Yeah. All right. What are some common everyday injuries? We'll get into some things related to the pandemic and coming out of the pandemic, but the everyday injuries that you would treat anyway.
As a knee specialist, I see a lot of knee injuries, obviously, cartilage tears, things like that are just kind of run-of-the-mill that can happen with just a twisting injury, from CrossFit to boot camp class to tennis or anything else. But a little bit more broadly in orthopedics, there's a lot of overuse injuries in children, younger athletes, and there's a lot of, let's just call it degenerative overuse as we get older, you could run 5 miles 30 years ago, but 5 miles now may feel very, very different to your patella tendons.
Right.
And so sometimes we see the overuse just because people are aging, their tendons are aging, and they get inflamed.
As we try to come out of this pandemic, and we're still sort of in the throes of it, but we're doing better because of vaccines. But more and more people are starting to get outside. The weather's getting better. So as we increase activity, what are we going to have to be careful of? What injuries are we likely to experience?
Right, so it is very, very common to see injuries from people going from a period of relative inactivity, which COVID obviously has been that for just about everyone, to a period of much increased activity. So a classic example would be the football player kid that shows up with 2-a-days or 3-a-days in August after not doing a whole lot during the summer, and they come in with tendonitis or this or that. So it's kind of a corollary to COVID, where a lot of people are coming out of quarantine and they're really just so thankful to see some sun, and they go out and they start running a bunch of miles or doing something very, very aggressive. So the key really is just to graduate into that and be progressive with your activity level and be very, very realistic and have a plan and not try to do it all at once.
Right, and the same thing with a casual person who said, well, before the pandemic, I would go and jog for 3 miles, and then they go right out there and try the 3 miles right after their first time out. So
then they walk into my office.
yeah, they walk, they crawl into your, they have to be carried into your office. You sent me an email one day that referenced a comprehensive team. You used the term comprehensive team when it comes to your sports med program. What do you mean?
So, Wake has every level, every piece of that team, and many of them across the Triad. And so, you might have your orthopedic surgeon at the top, but really we're actually the bottom of a funnel, where if it's a surgical, situation, we have to get involved. But there are physical therapists, athletic trainers, nurse practitioners, physician assistants, a lot of people that see those patients, touch those patients, and then, of course, diagnose those patients, and then out of that diagnosis is a treatment plan, and you've got a whole team of folks.
Yeah, of course, people see, when they drive by the interstate and everything, they see the main campus there, Wake Forest Baptist Medical Center, and they say, oh, well, I guess, Dr. Lucy must be talking about he's got a sports med clinic right next to the hospital, but you guys are a lot of different places.
So we have offices all over the Triad and beyond, and that relationship is growing with our relationship with Atrium down in Charlotte, but my office is in Greensboro. We have offices in Randolph County and Asheboro, High Point all the way up, Wilkes County, North Wilkesboro. So Wake Forest footprint in the Triad is quite large.
All right, up on screen, this will get you some information, wakehealth.edu/sports medicine. Try that out, wakehealth.edu/sports medicine. Dr. Lucy, thanks for all you do in helping people. Will you come back sometime?
Absolutely.
All right, we'll be right back. Triad Today, and I want to spend the next few minutes on a serious topic and understanding more about Alzheimer's, and we have an expert that's going to help us through that. On my immediate right, Tiffany Ann Sheldon Morris. She's a psychologist with Novant Health Memory Care. We welcome you to the program.
Thank you.
By way of Berkeley, California, well-traveled. And most folks know about Heart Month, and they know about Breast Cancer Month, but June is Alzheimer's Awareness Month. It doesn't get much attention. Why is that?
I think, to be honest, it's because of, quite frankly, the aging perspective in this country. So if there's a lack of attention on Alzheimer's Awareness Month, that unfortunately may reflect a little bit of our national priority.
Not easy to talk about either.
Not at all. And I think what happens is culturally, our society fights against aging more than it really embraces the wisdom of the senior members of our community.
Let me ask you sort of a clinical thing. Now, you don't have to go into a lot of detail, but for folks to understand, how does someone develop Alzheimer's? Because, some people think, well, I guess it's genetic, or I guess it's this, or I guess, how does that happen?
So what happens is it can develop out of a genetic heritability, but that's not a necessarily. In other words, what we can inherit is a genetic predisposition, meaning if I have a first-degree relative that develops it, there may be an increased chance that I may develop it. But what's really important to recognize is there's so many other factors that come into play that can influence the development. Things like physical health and nutrition and activity and cognitive stimulation in older age, and even social emotional well-being, social support. All these things are also factors in addition to something like a genetic predisposition.
Well, give me an example of a misperception. What do you think is is one of the misperceptions that people have about Alzheimer's?
Sure, I think it's a misperception to believe that dignity is lost with memory. I think it's a misperception to believe that if I can no longer take care of myself, then I lose quality of life. I think it's a misperception to believe that because there's no medical cure yet, that even if I develop Alzheimer's disease, there's nothing I can do to preserve quality of life. And I think it's a misperception to believe that if my brain is affected and afflicted with something like Alzheimer's disease, that I can no longer connect to joy in any way. I think those are big, big misperceptions.
What kind of, once someone has been diagnosed with this, and I've referred to this on the show before, that with many diseases, it's your disease. But with Alzheimer's, it's the family disease, isn't
Absolutely,
it?
yes.
What are resources that might be available to families if they just found out?
Sure. So our local community is replete with a lot of really, really good resources. The state of North Carolina, the Department of Health and Human Services, the Aging and Adult Services Division is an umbrella under which there are lots of services directly relevant to what we're speaking about because of the gamut that it spans. So we're talking about things like day services, placement services, adult protective services when that's needed, counseling services, care partner support is absolutely critical. Sometimes it's legal services, transportation services. There's so many different kinds of services.
How can I get to all that,
That
though?
really are
Is
the
there
game
like one
changers.
website, or, I'm going to give the Novant website in a second, but are there certain websites you can go to that sort of ombudsman-like, or what?
And really, I'm glad you brought that up because Ombudsman really can be key in connecting people. A lot of what we try to do at Novant Health and Memory Care specifically is targeted at connecting people on an individual level to the services that are going to best suit their family's needs.
Okay.
On a very personal manner.
Well, speaking of that, let me put this up on screen before I forget. NovantHealth.org is the general website, which gives you lots of great information. I just applaud what you're doing and what the program is doing. It's so vital, and I just appreciate it with all seriousness. Thanks for everything.
Thank you.
All right, we'll be right back. Today we have made some changes in our setup here at the garden. The table is out, the flowers are out, so that we can make room for Bendy, Bubba, and Pierre. Pierre is the white poodle. Hey, Pierre. He's heard his name. I do that too. Whenever I hear my name, I get up and roll over. And these are three great dogs. We're going to tell you more about them and why they're here in just a second. But on my immediate right and socially distanced over there, Roger Berendis, who is Vice President and COO of First Light Home Care. And we also have with us as first-time guest, Jenna Rittenhouse. She's Director of All Things Dog for the Bark and Fly Ranch. Welcome. Good to see you.
Glad to be here.
I'm going to start, Roger. What are some of the emotional and mental benefits to people when they interact with dogs? What are the benefits?
The benefits is they immediately relax. They come up to them and even unconsciously they start petting them, and you can see their demeanor calm down.
So that helps me with the
change.
stress and the mental and emotional, and also physical benefits?
Because if you don't have stress and things of that nature, you feel better.
Right.
Because when you get all excited and nervous and everything, that affects your heart, it affects your breathing, and a lot of other things that are going on.
And Pierre is being trained, I believe, to do therapy work, and especially for seniors and others. Bendy has done some, and Bubba is just Bubba. Bubba is... Anyway, Jenna, what is the, I need to ask you, what is the Bark and Fly Ranch, very quickly? What is that all about?
The Bark and Fly Ranch is a boarding, grooming, day camp training facility in High Point, North Carolina. We're smack dab in the middle of the Triad, so we are your universal one-stop shop for all things dog.
And as I mentioned, now Bendy has done some therapy work, right?
Bubba has, yes.
Bubba has.
Yep, Bubba Gump. He went through the CDC certification. Bubba, say hello. He says, I'm shy today. Go say hello.
Come here, Bubba. Come
Good
here.
boy. Yeah.
You're being talked about. Yeah.
But he once upon a time did some therapy work. We've retired him a little bit. He's on the older side, but and Bindi is actually a freestyle frisbee dog. But
Okay.
Bubba Gump went through the certification when I was in Charlotte. He did a phenomenal job.
What's the difference, Jenna, between a therapy dog, a service dog, and a support dog? Because those terms get mixed and bumped around a lot.
They do. They often get interchanged, and they could not be far from different from each other. Service dogs are trained and bred for specific purposes, whether it's bracing dogs, so people in wheelchairs can physically use the dog to get up out of things, to allergy alert dogs, to obviously you have your PTSD and those dogs that have done work with veterans. An emotional support animal is one that has to be prescribed through a psychiatrist. Right. So generally, those are the ones that, with a pre-existing, whether it's anxiety, depression, you name it, disorder, if the healthcare professional deems appropriate, then that, as opposed to a therapy dog, is trained to go through the Canine Good Citizen, the AKC Canine Good Citizen training to be able to go into those homes like Mr. Berenda's has and provide emotional support.
And you can do all this training from your place, right?
I can do the therapy dog and also the ESA.
Roger, let me ask you, because you and I are both senior citizens. And so why in particular are therapy dogs and dogs in general good for senior citizens?
Because they give them something to focus on. They give them something to focus on besides their own ailments. Too many seniors are living with a spouse of the same age,
right,
and not around a lot of other outside people, a lot of other interaction with them. They have interaction with them, so it gives them something to feel good about themselves. They're feeling valuable, and it helps relax them and keep them calm down.
And give us a responsibility, because at 5 every morning, our two poodles, they come to me and they want to eat. So I've got the responsibility there.
And it forces you to get up.
Yeah.
It forces you to get up in the morning.
Unlike Bubba Gump, who's forced to just lay down there. Bubba Gump's been doing what a lot of my guests do. He's just sleeping through the interview. All right, up on screen, firstlighthomecare.com. Please check that out. They do great service in helping people with health care in the home. And also a plug for barkandflyranch.com, or you can call 931-0909 to get to Jenna. For both of you, thank you so much for what you do. I really appreciate you coming.
Well, thank you for having us.
All right, and thank you to Pierre and to Bindi and to Bubba Gump, who is still sleeping. Well, that's all for this special edition of Triad Today. I'm Jim Longworth. We'll see you next week.